Welcome back to another episode of the Freedom Talks podcast, everybody. This week I'm here with Dr. Grace, who just started with us here at Freedom a couple weeks ago, and now she's at our Brookfield location. Some of us that are listening may have seen Grace at our Fox Point location as well. She's been doing a little bit of shadowing with Nina. But Grace, welcome.
Thank you.
So Grace,
Nice to
you've
be
been with
here.
Freedom for how long now?
I started at the end of July, so little over a month.
How's it been going your first month?
Oh, it's been great. Yeah, I like it a lot so far.
And this is your first job outside of PT school?
Correct. Yeah, I graduated in May. I have another PT job as well. So I do part-time at a hospital on some weekends.
Oh,
So
okay.
first job, but two first jobs.
What hospital?
I'm at St. Luke's South Shore down in Cudahy.
Okay. And is that just inpatient?
Correct. Yeah. So all patients in the hospital just on some weekends.
How do you find that um, balance between inpatient and outpatient? Because I feel like they're two completely different.
Yeah, they are very different. I enjoy both, so it's nice to still have a mix. I definitely like use different parts of my brain, I would say, for
Yeah,
each
right.
because it is very different in a hospital versus outpatient injuries.
So work in Brookfield and Cudahy. Do you live in Milwaukee or are you somewhere
I,
else?
I live in Tosa,
Okay, so
so it's
really
nice in the middle.
not too bad either. So are you every weekend?
Not every weekend. I do 4 shifts a month, so sometimes it's Saturday and Sunday, sometimes just one day.
And what are you working at Brookfield?
Monday through Friday.
So Caroline schedule basically.
Yeah.
Okay. Grace, tell us a little bit about where you grew up, how you got interested in PT.
Yeah. So I'm from here from Brookfield. So went to Brookfield East. So I'm a regular around the area. And then I got into PT because I did cross country and track in high school. Our coach in cross country was very into like whole body health. So wasn't just running. We talked about nutrition and core strength and preventing injuries, things like that. And then I myself also had a running injury. So I had PT here at Freedom. And so then I got interested in physical therapy. And then I went to Marquette, and my undergrad was in exercise physiology. And then I also shadowed some PTs in my time in undergrad at different hospitals and outpatient, and I really liked it. So I applied to Marquette's PT program my junior year and then started PT program my senior year at Marquette.
So were you not direct admit into the PT program?
Correct. Yeah. So I didn't apply my freshman year just because I wanted to keep my options open. I wasn't totally sure if physical therapy was my route or not. And so then I applied junior year. So then I was still in the direct program starting my senior year.
So you graduated in 6 total years, or was it 7?
Correct. Yep. 6.
Oh, so realistically, it's pretty much the same as anybody else.
Yeah, yeah, and I was still in all the same classes with everyone else that was in the direct program.
How many kids are in Marquette's program?
In the PT,
Yeah,
um, our class was 64.
of just one cohort, or
Yep,
split it into two.
just one.
Okay, because I went
Yep.
to Carroll, and we have 80 kids,
Oh,
which so they split us into two groups of 40, but these
oh, okay.
classes I feel like are just getting so big, and it's such a popular field still, and there's obviously kids that
Mhm.
still aren't getting into school.
Right.
So right outside of school, you just graduated in spring of 23.
Yep.
Did you
Mhm.
have a bunch of other jobs that you were looking at, or did it really come down to the inpatient outpatient with Freedom um,
Um,
and St. Luke's?
Yeah, so I was looking at a few other outpatient jobs as well. Freedom really stood out to me since it is the one-on-one care with patients.
Yeah.
So a lot of my other interviews and other jobs I was looking at had higher expectations of seeing multiple patients at a time, which I really like having the one-on-one time with patients. It seems like more quality of care. I'm able to build more of a relationship with patients. So that's ultimately why I really gravitated towards freedom.
How'd you find out about freedom?
Well, so freedom is where I went to PT when I was in high school.
Yeah.
I honestly just found it. I think when I had the injury, I was asking around people on the team, and I think someone else had also gone to freedom, and they
Yeah.
highly recommended it. So, yeah, it worked out.
So weren't treated by Jeff at all, and
No,
now you just get to work with Jeff and go through the interview process with Jeff.
yeah, yeah. My interview is actually with Scott at Fox Point.
Oh, so you didn't interview with Jeff at all?
No, when I applied, there's only openings at Fox Point, not at Brookfield. And then since I have an interest in women's health, then that was needed out here at Brookfield. So
Yeah.
then they thought I'd be a better fit here.
And how's it been going so far?
Yeah, it's been going really well. It's been nice. Like if I have some downtime in between patients, like if I have a cancel or something, then I've been able to either shadow the other therapists here or get to work on things with them. So that's nice to be able to learn from everyone here just because I am a new grad. So I mean, I obviously know what I know from school and clinicals, but everyone else here also has so many other skill sets that they know. So it's nice to get other therapist perspective on things or learn their techniques.
And Brookfield to me, it, compared to the other clinics, um, just because of it's smaller. Obviously,
Mm-hmm.
Fox Point, we have a ton of people, as you've seen when you've shadowed there. We have a ton
Yeah,
of
definitely.
therapists in Fox Point. Just based on the pure numbers, I think you can learn from a lot of people. But I always thought Brookfield was a super interesting setup because Jeff, with his osteopathic treatment, I think he's
Right.
really, really good at what he does.
Yep.
Very interesting to see it. Trenton, very thorough and really good at what he does. And then
Yep.
Kyle traveling, he's
Mm-hmm.
in a ton of different places. So
Yep.
I think right off the bat, it's Brookfield's a really nice place to learn, and it's a really small atmosphere, so that you can have a lot of that um, one-on-one coworker time as well, I think.
Right. Yeah, definitely. And like you said, yeah, each therapist treats differently and all
Yeah.
has their own different style. So it's been cool to pick up different things from each and every one of them.
And are you treating women's health right now too?
Not yet. So I take the courses in October and November, and then I'll be able to treat after the courses. But I'm excited to do that. I had a full clinical in pelvic floor, so I'm eager to get back to it.
Okay. So what were your other um, rotations?
Yeah, so my first one was inpatient rehab,
Okay.
and I was in Indianapolis. My second one was outpatient ortho. Um, Third one was the pelvic floor. And that also had some abdominal wall, so like post-surgical abdominal wall or hernias, things like that. And
Yeah.
then my fourth one was acute care.
Okay. A pelvic floor rotation to me seems pretty intense right away.
Yeah, so I took a specialty course at Marquette, like how you can take an elective course,
Okay.
and mine was in women's health. And so we would have class once a week and then also shadow a pelvic floor
Okay.
PT once every other week, I think. So that was a good introduction to everything.
Yeah.
Mhm.
And do you feel like you're still prepared to take the class or even ahead of because you're taking the Herman Wallen class?
Yeah,
So
yeah. I honestly feel like I might be a little ahead of taking the class just because I already have 9 weeks under my belt of
yeah.
treating. So I think it'll be definitely really good to learn like from the course and learn specific techniques and things like that. But I do feel like I'm well prepared for it.
Are those classes in Chicago?
No, they're actually at Fox Point.
Oh, really?
Yeah, at Freedom.
Wow, I did not know that.
Yeah, I think there's several other Freedom PTs taking it.
That would explain why everyone's pretty much talking about taking
Yeah.
it. Everyone's just on the same page of
Yeah.
travel at the same time. Now outside of the pelvic health interest, do you have any other patient population that you're interested in?
So I am interested in like oncology population. I wouldn't say I have a whole lot of experience in it, just in our women's health elective course.
Yeah.
We went over a lot of breast cancer, like post reconstruction, things like that, how there can be a lot of tightness from radiation or shoulder pain or back pain.
Yeah.
So that's definitely a big interest of mine. I would also say I have a lot of experience working with the geriatric population. So in college, I worked at a nursing home in the memory care unit.
Okay.
And so I do a lot of exercises with the residents there. So I enjoy working with the elderly population.
I'll have to send you. I don't know if you were working yet when Mike sent this out. I should go back and find it. Mike sent out a big continuing education course for oncology and different subsets. I'll have to send it
Oh, okay. Yeah, definitely. That would be great.
that he thought would be of interest to us. So since you mentioned oncology, I'll try and look for it and send it to you once we're done.
Okay. Yeah, that would be great.
Now have you taken any other courses yet? Not that I
No.
expect you to after
Right. Yeah.
being on
No.
it.
Hopefully dry needling in the future. Also hopefully TMJ in the future would be
Does
an
Mike
interest.
mention that to you yet?
Yes. Yeah.
Oh, you already got the bug in your ear.
Yeah. Yeah. Unfortunately, I can't make it to the November course, but hopefully in the future.
Is that the one at Bellin in Green Bay?
Yeah.
The TMJ one is very interesting. And I was just talking with Heather a couple weeks ago, who also does some pelvic floor treatment.
Hmm.
And now that Nicole left, her and I take a lot of the TMJ caseload, and she
Yeah.
said she sees a ton of crossover between pelvic health and the jaw. So I do think it's a very worthwhile course too. And Mike's really good at teaching it too.
Yeah, we also talked a lot about that on my pelvic floor clinical, just how a lot of it's related to increased tension or muscle
Mhm.
tension. So yeah, with TMJ and pelvic floor having that tension.
And Jeff and Trenton both treated as well, I think, too, and they're really good to learn
Yep.
from.
Yeah, and in my outpatient clinical, I see I actually did a lot of TMJ and headache and cervical pain, so I actually do have some experience in it as well.
Oh, okay.
Mhm.
A lot more than we got in PT school. We just measured
Right.
how to measure range of motion,
Yep.
talked about maybe some stuff, but that was it.
Yeah.
Now, once you found out about Freedom, was it online that you saw that we were hiring?
Um, yes. Yep. Is online.
And then interview right away and then move things along from there? Or do you have other
Right.
interviews going on at the same time?
I did have other interviews going on at the same time. And again, it kind of came down to like my morals and wanting to provide best care
Yeah.
possible and having that one-on-one time. So yeah, the other interviews were with places that had multiple patients at
Yeah.
one time slot. So
So far, do you think you made the right choice?
yes, I would say so.
Um, well, it sounds like you had multiple interviews,
Hmm.
which I think is a skill that, or not even a skill, but just an experience that some people experience and some don't.
Hmm.
Anybody, even a new grad, like, do you have any advice to anybody that is going through multiple interviews or trying to look for the right job since you really just went through that experience and it's fresh?
Yeah, I would say just trying to be genuine to yourself that comes across the best. You don't want to, be faking it or pretend like you know something if you don't. So I was just gonna be as genuine as possible, show that I'm here to care for the patients, and use the skills that I learned from school and clinical, but also still learn from all the other therapists. So being genuine, and being confident as well, trying to be as confident as can be.
Just like the rest of us, just be as confident as we can. And then from there, whatever
Yep.
happens is going to happen.
Yep. Yep.
Now, speaking of Brookfield, we talked about it a little bit earlier and all the different therapists there. Have you been exposed to any muscle energy, osteopathic stuff before um, seeing how Jeff does things?
Not a whole lot. I feel like the first time I was watching him treat, I was a little lost. So I had him kind of explain and go through what he was doing on me so that I could feel what he was doing.
Oh, you
Um,
probably love that.
yeah. And at first I was like, I don't know if I believe this. And then I went home and I tried it on some friends and they were like, wow, I feel so much better. And I was like, oh my gosh, it works. Yep.
In treatment, I believe a lot in what it does. I do it a lot on a lot of people. So Jeff and I together, sometimes it gets long-winded. But I do think also I'd be really curious, public health as well, and TMJ is included in it. I mean, we do some muscle energy S stuff with some TMJ. But I do think there has to be a connection there too, which hopefully
Mhm.
we'll see shortly.
Yeah, I know. Yeah. I'll have to see if I learn any new techniques from the courses. Yeah.
Are they both in Fox Point? The
Hmm.
public health
Yeah.
2 weekends,
Yeah. Hmm.
one in October and one in November.
Yeah.
And that who's teaching that?
I honestly don't know. I know I asked Nina and she's not teaching it.
Oh, Nina's not.
No.
Okay. Do you know anybody else who's taking it?
I know Aaron at Fox Point is. Um, and then I think a few of the newer therapists at Fox Point,
Okay.
and then maybe one at a different location. Um, that's not very helpful. All I can tell you is Aaron, but I know there's multiple other
Hmm.
women that are doing it.
No, I mean Nina, as you've seen with her schedule, I mean she's always jam packed. Very rarely does
Oh
she
yeah.
go or cancel. So I think she has developed this baseline of a lot of people that we treat and that we bring into the clinic. So
Yeah, definitely.
I think it should be a good turnout too. Usually Fox Point classes like are really, really big
Okay.
because it kind of is a good space to have classes depending on
Yeah.
who it is, where it is. So
Yeah.
I think you'll like it. That's in October.
Yep. Yeah. October like 15th, 16th. So after
And
that, I'll be treating pelvic floor.
that's what I was just gonna ask. After the first one, can you treat pelvic floor?
Yep. So it just has to be within the scope of the practice. So I think the first one is, I think bladder, so like urinary incontinence.
Okay.
And then the second one, I believe, is pelvic pain.
Okay. And
Mhm.
then what's the first one just is kind of basic treat,
Right.
and then the second one keeps diving deeper.
Hmm.
And then does it keep going?
Yep. Then there's more. There's a bowel one, a male pelvic floor. Um, I think there might be one specifically for pregnancy and postpartum. So
Okay.
I definitely am interested in taking more in the future.
Do you have any specific interests in avenue of pelvic health, or just pelvic health as a whole, or women's health as a whole, I should say?
Say just as a whole, I definitely am interested in like pregnancy, postpartum. I have a lot of experience with urinary incontinence with my clinical.
Yeah.
I'd also say at my clinical, we did a lot of post prostatectomy for male pelvic floor.
Okay.
So the male one in the future would be nice to have that population.
I know Nina and I have talked about it a little bit. I think she just took a course not too long ago at Marquette that talked about male pelvic health a little bit.
Uh-huh.
Um, and we haven't really talked much about it since, just because we're both so busy. But we did mention that it would be something to hopefully pursue to be able to treat more people.
Hmm.
Now, Grace, I'm going to assume that outside of physical therapy, you don't just study and look at research about being a physical therapist 24/7. Outside of work, what do you like to do?
Yeah, I love the outdoors and I like to be active. So I like to run, walk, bike, hike, really anything active outdoors. I just went camping this past weekend. I usually like to go camping at least a few times a year. My friends and I, we've started pickleball. I'm not very good, but we go once a week for that. So, what?
What do you guys play?
We usually switch it up, but lately we've been going to, it's called Banting Park in Waukesha just because it
Yeah.
has lights, so then we can stay there later too.
Is that the one that's kind of downtown? Oh
Yeah,
no.
near downtown. Yeah.
I think I know where that one is. I think I used to live right. I think
Oh,
that
okay.
that is very popular, and pickleball is just a super popular sport in general right now.
Yeah. Yeah, definitely.
Are you any good?
No. No, it usually takes me a few games to warm up and then I'm better, but the first game I play is so bad.
You guys do singles or doubles or just kind of whatever?
We do both. It depends on how many people show up. We have a group of like 10 of us that'll
Oh,
go. So
cool.
then if there's enough for doubles, and we just kind of rotate through.
Show up and play.
Hmm.
Nice.
Yeah, it's fun.
Anything else besides pickleball, hiking, camping?
Um, I guess just hanging out with friends and family. So, since I'm from Brookfield, it's nice. I've got family here and still friends from home. And then since I went to Marquette, I've got still friends that live in the Milwaukee area. So, yeah.
How do you feel now treating in the community that you grew up?
Yeah, it is a little funny because there's just lots of connections. So I feel like I'm always, asking like, what are you doing this weekend? Oh, like, yep, I've definitely been there, or like kids or grandkids that went to my high school or something. So there's always connections and things to talk about.
I think that's something that's nice about freedom too. I mean, the one-on-one time to me it is essential to good patient care, in my opinion. I feel very strongly about that. Um,
Hmm.
I think anybody can go through exercises,
Hmm.
actually get through with people and get to know them so that we can better treat them. I think uh, lets us stand out at freedom. Um, and now with you as well, I think with you the opportunity to also now treat in the community that you grew up in is a huge benefit for both you and for freedom as well.
Right. Yeah, bringing in people that I know. Yep.
Have you done that?
I've given my business cards to like some family and friends, but
Yeah.
I don't think anyone's really had any injuries yet or anything that they need PT for, but definitely spreading the word out.
How did you grow up close to where the clinic is in Brookfield?
Yep. Pretty close. I went to Burleigh Elementary, which is literally like in the neighborhood.
Now, where the Brookfield location is on Capitol and is that
Calhoun.
Calhoun? Where is
Mhm.
Brookfield East compared?
Brookfield East is, I guess, like on a compass, it would be a little southeast of that. So
So
like,
Central's right there, and then East is a little farther down.
what was that?
Where's East?
It's on like Lily Road in Burleigh.
Oh, okay.
Mhm.
And obviously, Central is right by the Brookfield location.
Oh, mhm.
Yes, just down the street off Calhoun, I think.
Yeah, yeah, right on Calhoun.
And do you live in Tulsa now?
Yes, I do.
So it's a 10-minute drive to get to the Brookfield location.
Yeah, sometimes more like 20, but yeah,
Which part
still.
of Tulsa?
I live like really close to the Bel Air on North Avenue.
Oh, okay. So you gotta
Mhm.
drive through the nice construction all the time.
A little bit, a little. I don't take the highway or anything.
Oh, you just take north down.
Yeah, north to, and then I go on Capitol.
Easy.
Yep.
All right, Miss Grace, one more question. I like to
Okay.
end everybody with this question because I think it epitomizes who we are as people as well as physical therapists because I think our profession's always evolving. So we always are focused on what's next. Um,
Mhm.
so I always ask what motivates you to be a better person or a better physical therapist because I think it does apply to both.
Yeah, I like that question. I mean, obviously, the patients that I'm treating, it motivates me to be better 'cause I know that I don't know everything by any means. So, like, if I feel like maybe I'm stuck with a patient, I don't know how to get them better. If like they're still coming in with pain the next session, then again, like I was saying earlier, during free time, I might ask the other physical therapists here if they have any good ideas or anything different that they would try, just so that I'm really trying all different avenues and perspectives on a patient case. Um, and then also, I would say being a better person, using those active listening skills, like listening to my patients. Because like like you were saying, you can run through exercises all day, but really to build that genuine relationship is so important. So just trying to listen to your patients and be their motivator through whatever they're going through.
I agree. I agree. Really good answer. Well, Grace, thank you for joining us today. I know I had to fit you in, kind of squeeze you in between patients here, especially with how busy we are, 45 minutes. So I'm glad that we finally took a little bit to get something scheduled. But um, thank you for coming on today.
Yeah,
And if
thank you for
anybody
having me.
and if anybody has any questions, Grace will be at the Brookfield location, right? Just Brookfield.
Yep.
But if anybody has any other questions, you can reach out to any of our locations, either at Brookfield, Fox Point, Maguanago, or Grafton. Thanks for listening, everybody. Let's